So Rick Mountcastle is a retired federal and state prosecutor. He's a producer for the documentary No Country for Old People. He's known for his work as the lead prosecutor against Purdue Pharma, chronicled in the Hulu miniseries Dopesick. With over 2 decades of experience, he has prosecuted corporations and individuals for exploiting nursing home residents. He led significant cases, including the prosecution of Abbott Laboratories for fraudulently promoting Depakote as a chemical restraint for agitation in nursing home residents with dementia, resulting in $1.5 billion in penalties. Rick believes in educating the public to reform the nursing home system, and the documentary aims to highlight these issues to inspire change. So, Rick, you're going to start this off. Help us understand the evolution of long-term care in America. How did a system meant to care for our most vulnerable end up prioritizing profit over quality care and have so many workforce challenges?
So that's asking for 60 years of history in 5 minutes or less. I'll do
Yes.
my best. So Medicare and Medicaid were signed into law in 1965. And from the very beginning, the long-term care component was treated as what I'll call a Frankenstein program. Congress didn't want it to be federally funded because of the cost. So it was funneled to the states to be included under their Medicaid programs. Never mind that the federal government provides the states roughly 50% of their Medicaid budgets. But like so many things in healthcare, it was the political illusion that was important, not the reality, okay? So Medicare, the program that was set up to provide healthcare for elderly Americans, really doesn't pay a dime for long-term care. It all gets funneled through Medicaid. Now, adding to the confusion inherent in what's really created this Frankenstein system is that Medicare coverage was set up to provide up to 100 days of post-hospitalization rehabilitation in a skilled nursing facility, the very same facilities that provide long-term care. And this applies to both Medicare recipients who are residents of long-term care facilities, as well as those who do not live in the facilities. And to make things even more confusing, the policymakers thought it was a good idea to allow Medicare to pay significantly more for the rehabilitation that occurs in skilled nursing facilities than Medicaid would pay for this very same patient who is in that facility as a long-term care resident. So the result is a fractured system where Medicare patients or beds, because in the corporate world, they're treated as beds or commodities. Medicare patients or beds are generally more valuable than Medicaid patients or beds in the same facility. And a patient can be both a Medicare and a Medicaid patient, and that patient is viewed as more valuable when they're being paid for by Medicare's rehab funds than they are when they're there as a long-term care patient being paid for by Medicaid. Now, the Nursing Home Reform Act of 1987 established federal standards for care and for the enforcement of those standards in this fractured system. But the surveyors who are responsible for enforcing these standards work for the 50 states. So you have 50 different state-administered inspection and enforcement programs, which are, through the back door, paid for by federal funds. And then now we're at the point today, having fast-forwarded through 50 or 60 years, that 72% of nursing homes are for-profit, that we have this very exponentially increasing demand for nursing home beds as our population continues to age. And according to a 2019 Health and Human Services study, 70% of adults who reach age 65 will need some type of long-term care, services, and support during their lives, which means that the pressure on this Frankenstein system, the pressures are immense and growing exponentially by the day. And the system is not able to prioritize quality of care in the face of a patchwork payment, oversight, and enforcement system. This fractured system is no match for the decades-old business model where owners and operators maximize profit by understaffing and underpaying direct care staff. So where are we today? Owners and operators, of course, seek to maximize profit, but maximizing profit means reducing direct care staff, which means that patient care suffers. Low pay and overwork due to understaffing means that nursing home care workers are fleeing to other better paying and less grueling jobs, like working in retail or even in fast food. And the industry continues to argue that Medicaid reimbursement is too low, it's insufficient. But we can't tell whether that's true or not because related party transactions are not reported, such that according to a 2024 study, up to 63% of nursing home revenue is diverted out as extra profit through secret related party transactions. On top of that, on the enforcement end, inspections have fallen behind due to the pandemic and due to the lack of being able to get people or workers to do the inspections. And enforcement, if any exists, is anemic at best. To top it all off, the nursing home industry spends hundreds of millions of dollars annually for lobbying and campaign contributions to maintain the status quo. They oppose minimum staffing standards and any requirement for financial transparency that might shed light on the adequacy of Medicaid reimbursement and whether excessive amounts are being diverted out through the secret related party transactions. Today, Medicaid pays on average $250 a day for long-term care. How it is that a facility cannot provide adequate care for $90,000 per year is puzzling to me, especially when investment experts tout nursing homes as great investments. However, when viewed alongside a Medicare rehab patient with a Medicare reimbursement rate that is significantly higher, and the ability to double dip after day 20, where Medicaid covers the resident's copay if they're both a Medicare and a Medicare patient, we can see the dilemma for nursing home operators who are under pressure to maximize return on investment. The human cost is systemic neglect and abuse, which is rampant, and a standard of care in our nursing homes that means the loss of dignity, the lack of care, the prevalence of pressure wounds, infections, malnutrition, dehydration, in short, misery. And No Country for Old People is a docuseries that is designed to shine a bright light on this dysfunction. It's designed to educate the public about this Frankenstein system and its impact on our most vulnerable by storytelling that touches the heart. It's intended to educate and activate the public that doesn't know and may not want to know about this broken system. And basically it's intended to encourage people to care. We've partnered with Buffalo 8 as our distribution agent and are looking for a premiere on a premium streamer soon. And along with that premiere, we're looking to partner with advocates across the country to launch a grassroots reform movement that's called ROAR, Respect, Oversight, Advocacy, and Reform. And to that end, we've retained the right to screen No Country for Old People or excerpts from it for educational and advocacy events. We're scheduled to present at the Virginia Governor's Conference on Aging in May. We're working on a screening with the Kansas Advocates for Better Care in the fall. And we'd love to work with your organization or any organization that is interested in advocating for better elder care. And finally, we welcome your support. We're raising funds for music licensing and insurance for our education and advocacy events. So go to nocountryforoldpeople.com to donate. All contributions are tax deductible through our fiscal sponsor, the National Consumer Voice. And also on the website, you'll find a very extensive description of ROAR. We invite you all to join the movement, and we invite you to care. Thank you all.
Thank you, Rick. That's a lot to pack into a little bit of time. I appreciate your efforts.